G'day, it's Monday afternoon. No, start again. G'day, it's Wednesday afternoon. It's day 5 after surgery being on previous Friday the 29th. And I've no longer sporting the world's daggiest accoutrement, which is a catheter. It was really starting to get unpleasant and really starting to sting, and any kind of lateral pressure on the end of your penis is just becoming super uncomfortable. So they pulled that out today. They pulled out basically everything. A couple of marks here which are from some sort of electrode or something that they put on in surgery. Secret surgeon's business. Anyway, pulling the catheter out, yeah, it's a very uncomfortable sensation. Doesn't exactly hurt, hard to describe, but just not nice. Anyway, I've been, first crack at the championship wearing a male nappy with a pad inside. Was able to do a wee within about probably 5 minutes of drinking like a salty solution of water, which they want you to do. They want you to be able to pass water before they let you go. So essentially the trip today was to go to Sydney to get a cystogram, that's right, where they fill your bladder full of opaque dye, radio opaque dye, to make sure there's no leaks around the end of the anastomosis or the join, I believe. Anyway, so that was all good. There were no leaks. Happy days there. Also got the pathology back. No cancer. So, that is awesome news. And that's, as I said to the nurse, every guy just wants to think, when am I going to have sex again? The reality is, the question you should be asking is, have I got cancer? Answer, no. So that's awesome. So they do use some terminology which I've presently forgotten. It's no margins, nothing near the margins is the term that they were using. So with my Gleason, 4 plus 3 equals 7, there was concerned, there was cancer all through the prostate. It was 38 mils, it should be 24 mils, something like that. So a little bit enlarged. You can do the maths yourself. What's that, 40-50%, something like that. Anyway, so today was meeting with the surgeon, which was brief because he was rushing off to more surgery, and the nurse took out all of the bits and pieces here. I still feel distended and bloated. Anyway, the nurse took the dressings off, thank you, the dressings, using my powers of English, and also, as I said, took out the catheter, and taking off the pad that was there was, look, this is why men shouldn't wax, because it's extremely painful. Very long trip to Sydney. We went down on the train this morning, came back. I'd left my car in Sydney because I was there working the week before, so train down, car back, that was all fine, no problems at all. And basically tomorrow I can't do any of my Kegel exercises, which are our pelvic floor exercises. I can't start them until tomorrow. I will be starting them in earnest. I really felt that I had at least some partial control of the bladder this afternoon. Every time I've done a wee, there was about 100 mil of leakage between, say, 12:30 and now, which is 5:30. So 100 mil over 5 hours, and I've been to the loo 3 times, haven't had a lot of water. And they do encourage you to drink, but not a lot, because if you drink too much, then you can, that you don't want to drink too little, because then the urine becomes very concentrated and it basically aggravates everything. But you don't want there to be too much urine, because then you're putting more stress on all of the functioning parts. So it's a bit of a balancing game. And also, the more water you drink, the more chance more leakage you're gonna have. So no booze, no coffee, that's fine. I'm very happy with that. And basically, this is day 1 of back to life, back to reality, the new normal. Well, g'day. It's day 8 after surgery, and I'm actually feeling pretty good. It was amazing getting the catheter out. The catheter by basically day 5 was getting really, really painful, very difficult to have. Even in every time something bumped the edge of my leg, it would obviously very, very tender place and really, really uncomfortable. So I had a cystogram just to check if there were any leaks. There were no leaks, which is great. But a doctor came in and said, the end of the catheter, there's a little bulb on it so it doesn't pull out of the bladder. And that was pulling and sitting right up against the stitch line at the end of the bladder. And he said, I've got to push it back in to get a better view with the radio opaque dye, the iodine that they pump into your bladder so they can see that there are no leaks. And he did all that, and that wasn't too uncomfortable. But then when they pulled it out, they gave me some Ural, which is just like some maybe some hydrolyte or electrolyte drink just to make you go to the toilet. Within 5 minutes, I went and did a wee, and it was both messy and stung like anything after the catheter came out. So don't let that put you off, because it's now, that was on Wednesday, it's now Saturday, and wees have gone back to normal. Yes, I'm wearing incontinence pads, and I'm keeping a bit of an incontinence diary. So looks like I'm leaking maybe between 4 and 10 milliliters overnight, which is pretty good. And then usually it's during the day, and I'm doing lots of my pelvic floor exercises, which are pretty easy. Kegels, I think some people call them. But the incontinence side is really, really coming along. I've also started on Cialis with 5 milligrams of Cialis. So I'm feeling good, and belly is looking pretty good. So these are obviously, that's where the drain came out, and 1, 2, 3, 4 5 mil incisions for the various parts of the Da Vinci machine. So I'm actually quite happy that don't quite have my flat tummy back yet, but give myself a break. It has been chopped up a week ago, and I'm working on it, and I'm really working hard on this incontinence thing, and everything else I'm taking day by day. But pretty happy with the recovery so far, and fitness and core strength, I think, is one of the keys. Okay, 13th of October. So I've had the surgery 2 weeks ago today, and I'll just show you the damage. So that's basically, it's starting to get pretty itchy, I've got to say, just because all the hair is growing back. All that kind of bloating and stuff has gone away, which is really nice. It felt quite distended or gassy, or can't quite describe it, but it was quite uncomfortable for a while. Catheter's out, that's fantastic. Bladder control has been really, really good. I'm working really hard on my Kegels, my pelvic floor exercises. I'm using a Tina number 1. I was using a number 3 pad, which is kind of the default, I guess, that most guys would pick. The number 1, I think it holds about 170 mils. Don't quote me on that. It's all available online. I'm ending up using one pad every 2 days, and I'm leaking it, and at 2 weeks I'm leaking maybe 30 to 40 mils a day. So I'm absolutely thrilled with that outcome. You can kind of feel it, and it's worse in the afternoon, as in you get more dribbles in the afternoon, and by the time it starts to dribble, you tighten up your pelvic floor, and by then it's like the wee is in the portion of the urethra between the bladder sphincter and the end of your penis, so it's going to leak out regardless. So I've got to work on that. The other thing has been that I've been waking up in the night, which I would never normally do. I've been completely off the booze, which is good for me, yay, for 2 weeks now. And what I would normally find is, before, if I had more than 1 glass of wine, and who doesn't like to cook with a good glass of red, I would find that would keep me up. Common complaint with blokes my age, our age, whatever, too much booze, wake up in the middle of the night, you fall asleep in a jiffy, but it just keeps you up. So back to the bladder. I'm finding that my bladder has, I guess my theory is that it's shrunk while you've had the catheter in, because the bladder hasn't had to expand, because every time urine drips in from your kidneys, it goes straight out again. So now it's got to relearn to expand and inflate, and so I'm kind of working really, really hard, as I said, to do that. I don't want to force my bladder to hold as much liquid as I can, although I did wee in a jar and measure it this morning, so 2 weeks, when I was pretty bursting, and it held 350 mils. So I'm meeting the pelvic floor physio on Monday. I'm going to ask her if that's normal. I didn't have any weeping holding that in. I could really hold that in, but 350 mils was about it. And I think normally for guys, you might expect maybe 450 mils out of a really, really, really full bladder. So I'm thinking it's still got some stretching to go. And I think once it's stretched, it's going to give me more capacity to hold the wee in overnight as well. So I've only slept through the night once without waking up, and I did wake up at 5:30 a.m., which is a little bit earlier than normal, but for me that was a real win. Whereas last night, took a step backwards, woke up twice, 1 a.m. and 4 a.m, needing to go to the toilet. And it seems that the urine at night is more concentrated, so it does sting a bit. Or it's because the nerve bundles maybe are more sensitive around your penis, so it's going to be more sensitive because of that. It doesn't hurt, it doesn't sting, it's not like a UTI feeling, it's just a sensation, but it's not entirely unpleasant. It's just something that you're going to have to work through. But the fact that it's 2 weeks, I've got zero pain, I've got no perineal pain at all, nothing, no pain in my bum. I can sit for hours and hours working without any problems. I'm walking, I can even go for light jogs if I want to. I've got no issues with that, with continence or anything like that. It's just part of what I'm considering to be rehabilitation, which is do as much as you can until you feel overexerted. At this point, I haven't felt overexerted at all. I'm walking maybe between 3-4 kilometers, so not very far, but I'm trying to do as much as I can. I really, really, really want to accelerate my healing. So first off is continence. And then I'm also taking 5 milligrams of Cialis a day, which is, I believe, basically it's a low dose Viagra. That's to get blood stimulation down into your groin. And I've read, there is actually a scientific journal article that says there's inconclusive proof, but it's enough to warrant further investigation that basically self-stimulation, yes, the big M word, masturbation, is going to help with your sexual erectile dysfunction recovery. So that's fine, that's not a problem. Happy to work on that, just to try and get the party started. Although, speaking to a very good mate last night who'd been through the prostate cancer journey 2 years ago, he has said in only yesterday that it took him 2 years to get back on the wagon and to have a normal and natural erection, and he had 50% nerve sparing on one side. Now, my surgeon said I had really good nerve sparing on the left side and partial nerve sparing on the right side. I need to talk to him in a couple of weeks when I have my post-op visit to see what that actually means, partial nerve spare. So, don't really know. But again, the major news for me at the consult with the surgeon after the operation to get the catheter out was that the margins are clear and I've got no more cancer, which is outstanding. What I'm doing, I'm keeping a continence diary, so I'm weighing the pads at the end of each day, so I know how much wee I'm weeping, trickling, dribbling, and I think that's important because it gives me something to beat, it gives me something to work towards. And I'm also keeping a cancer diary. I've called it My Spanish Dancer, and every time something happens that's related, either a cost, a discussion with a medical professional, you know, some stress at home, anything like that, I'm keeping a note of it because I really want to try and capture, because believe me, I'm never going through this again. I kind of want to capture in the moment what I'm feeling. I don't know if it's going to help me in any kind of future space, but I'm doing it. And I think definitely the continence diary is exactly, I would really recommend that anyone going through this do that, because it really does give you a track of how well you're tracking with your bladder control. So keep doing your Kegel exercises, your pelvic floors, particularly, and it should be automatic. Every time you go to stand up, clench. Every time you go to do anything that's physical, if you're squatting down to move something or lift something, not too heavy of course, clench, get ready, and that will absolutely help you. So everything that your medical advice is telling you is what you should be doing. All right, so that's the damage 16 days post surgery. I've just a bit red because I've just rubbed off all of the adhesive marks there, but that one's pretty good. These ones feel a little bit raised, and it's itchy. I've got to say that it's itchy. I think mainly because the snail trail is growing back. Anyway, the gas is gone, the bloated feeling is gone. Feels a little bit firm in there, and obviously this is the slit where they pull the prostate out in a bag. That's the damaged goods exit, and these were for the cameras and the robotic wands. So not too bad, happy with that. All right, quick update. It's been basically a month since my surgery, and today is a pretty good day. I'd totally forgotten, but you know, you can actually take these off. So a friend of mine pulled these off. There we go, and I'm pulling these off again. So this Hyperfix basically reduces the impact of scarring. Putting in a bit of fat there, Julian. Not enough exercise. So there we go. So that's the damage a month post surgery. So I'll get some metho, clean those up on my flabby belly, and otherwise I'm feeling really, really good. I'm going to cover continence. So I've been working really hard on that. I'm basically I'm wearing a #1 pad every day, but it ranges from nothing at all, so no leakage overnight or during the day, to between maybe 10 to 20 mils. And I'm doing that by weighing the pads 4 times a day. And when I go to bed in the next morning, and that lets me know how much wee has leaked out. So I find it's much, much harder in the afternoon to hold on. So between say 4 p.m. and 7 p.m. But I'll go into that in a bit more detail in another video. But I just wanted to pull off all of those things, those nasty bits of mucky coverings, and move forward with my life, cancer free. All right, me again. I've spent about a minute just trying to clean up the wound area. So they actually feel pretty flat. Oops. Oh, by the way, I'm not perfect. It's a shirt for men's mental health. If you think that refers to the owner, it doesn't. Anyway, so scars have healed up really, really well. So the stuff that was on them basically softens out the top of the scar tissue, and I just need to work on removing some of that excess flab. Anyway, the other very exciting thing is I'm going to try. I've been feeling so good lately that I'm going to try to jump on my exercise bike. So the great thing about this is if it hurts, a bit of perineal pain, I can jump off straight away. And I think this is really important because 1, cycling is kind of my thing, and 2, there's a lot of discussion on lots and lots of groups about when you can go back to surgery after having a robot-assisted radical prostatectomy. And I've spoken to the physio that I've done all the pelvic floor work with where I live, and I said, look, is it going to hurt me physiologically? As in, am I going to bust anything? And she said, no, it's just going to hurt you, full stop. So basically, if it hurts, I'm going to stop. It's as simple as that. So I can't damage anything. It just might cause me a bit of discomfort, but I'm going to have a crack and see how I go. Now you'll notice that this is a very, very wide comfort saddle, and it actually has a silicone topper on it. This is not my saddle. I'll show you what my saddles are like. So these are my weapons of pain. So a standard cycling saddle for my mountain bike and my road bike, and not this soft, wide ass comfort saddle. Feel a little bit of pressure there, but it's not uncomfortable at all. The main thing is going to get some fitness back in the old thighs. So it's been a month, actually 5 weeks since I've been on a push bike. Thumbs up. Very happy with this. Very, very happy with this. I figured while I'm feeling pretty good today, I'll try some push-ups. All right, they would have hurt a week ago. Would have put a lot of strain on my tummy. So I'm feeling good. It's good. Don't get too excited. Still really happy with that progress. Alrighty, just want to get out of the wind. 5K's into a very gentle 10K ride just around a local velodrome. Exactly a month since surgery, so feeling good. Only planning on doing 10Ks. See how the perineum feels tomorrow. Sore ass, no more riding. Alright, I don't think I'm going to hit 10Ks because the rain's coming in, but really surprised how good I feel. I hope I'm not doing anything really stupid here. Anyway, too windy to ride, too windy to talk. I'm going to get home. 7Ks in out of 10.